Mike Jeffreyon, and this is my oral case presentation. I wanted to discuss with you my patient that I had an encounter with the other day. Her name is Annie Smith. She is 36 years old. She's a mother of two. Her oldest daughter is 3 years old, and her youngest daughter is 11 months old. She's a Caucasian female. She came in for a medication follow-up and also a routine checkup regarding her prediabetes diagnosis. She presented to this clinic 6 months ago after gaining weight from her previous childbirth, and she, at the time, weighed 212 pounds, and her BMI was 32.5%. She stated a concern about her weight and also a concern regarding her family history. Her father is a type 2 diabetic with a history of hypertension and renal insufficiency, and her mother is also a type 2 diabetic who also has a history of hypertension. Annie at the time stated a desire to stop her course of developing type 2 diabetes at that time, and she also expressed a desire to lose weight and to gain energy so she'd be a better parent, mother. At the time, Annie presented 6 months ago. Her biggest complaint was her weight gain, her fatigue. She, at the time, had a BMI of 32.5. Currently, she has lost 52 pounds. Her weight as of today is 170 pounds, and her BMI has been reduced down to 27.5%. At first, with Annie, she stated that she wanted to just try lifestyle modifications, basically start exercising routinely and to start eating healthier, more fruits and vegetables, eating at home, not eating out, and things of that nature. She currently states that her exercise routine 6 months ago started with working out 3 times a week for 1 hour. She's now increased it to 5 times a week for at least 1 hour. She states that she has been eating more fruits and vegetables. She's been eating at home. She's preparing more healthy meals. Her review of systems, let me go back to her medications. Currently, she's taking 1,500 milligrams of metformin orally once a day, and she's also taking 37.5 milligrams of Adipex once a day. Her last menstrual cycle was 3 months ago. However, she has a Mirena IUD, and she states that her amenorrhea has been due to her IUD. She has no allergies to any medications or to any food that she knows of. She is not using any other herbal medications, and she states that she uses ibuprofen 600 milligrams as needed for aches and pains. Her family history, as I already mentioned, her father is a type 2 diabetic with a history of hypertension and renal insufficiency, and her mother also is a type 2 diabetic with a history of hypertension. She denies any chronic illnesses in any of her siblings. She states little knowledge of her grandparents' medical history. She states no recollection of her paternal grandparents' medical history. She states that her maternal grandmother is deceased of natural causes. She denies any knowledge of any of her chronic illnesses before she passed away. She also states that her maternal grandfather is also deceased, and she states that she believes he had a history of prostate cancer. Currently today, her review of systems, basically her constitutional review of systems, she's alert and oriented. She states mild anxiety, and she contributes that to her use of Adipex. She's positive for increased energy, and she's also positive for a 12-pound weight loss since her previous visit 6 weeks ago. Her head, ears, eyes, nose, and throat are all normal. Her skin is normal. It's warm, dry, and intact, normal color for ethnicity. She denies any chest pain, any palpitations. She denies any shortness of breath or any dyspnea. She does not have a cough. She states that she has had normal bowel movements. She denies any diarrhea or constipation. She states a normal appetite. She denies any vaginal discharge, no dysuria or hematuria. She's neurologically intact with no dizziness or focal weakness. Her musculoskeletal review of systems is normal. She has no reported unusual bruising or abnormal bleeding. She has no lymphadenopathy. She denies any polydipsia or polyuria. She does not appear to be anxious during the physical exam, other than her stated mild anxiety. She is alert and oriented. Her skin is warm, dry, and intact. Her head, ears, eyes, nose, and throat are all normal, normal cephalic with no visual changes. Her neck is supple with normal range of motion. Her heart, or cardiovascular assessment, I should say, she denies any palpitations. S1 and S2 are auscultated. No murmurs, gallops, or friction rubs. Her lungs are clear to auscultation. She has no cough. Her abdominal assessment is benign. She has no masses or no tenderness. She denies any nausea or vomiting, and she states a normal appetite. Extremities are all normal with normal range of motion, and her neurologic assessment is alert and oriented. She has no focal deficits or dizziness. Her assessment and plan, basically, she states a mild anxiety with her Adipex. She's been wildly successful losing weight and increasing her energy with her lifestyle modifications, and also with the use of metformin. After a discussion with her today, we've decided to discontinue her from the Adipex. She has been able to increase her exercise to 5 times a week, at least 1 hour each session. So she's made the modification lifestyle changes necessary to continue to lose weight. Part of her discussion today centered around what should be her target weight loss, or what should be her target weight. After discussing it with her, she's reduced her A1C. 6 months ago it was 6.2. 6 weeks ago at her last visit it was 5.7, so that has been markedly reduced. That was one goal that has been met. She wanted to begin exercising and to start eating more healthy to lose weight that way. After discussing it with her, it just doesn't seem that we need to continue her on the Adipex. She doesn't really think that she's getting much from it, and with the mild anxiety, there's really no benefit in continuing that. She is going to continue her exercise regimen. She's also going to continue her healthy meal preparations, and she's going to continue with her normal diet now, which includes plenty of fruits and vegetables, and that's about it. Anyway, so our assessment and plan basically is to continue the 1,500 milligrams of metformin orally each day, stop the Adipex, and continue with the exercise and the diet that she's now on. Her target weight was set to be 160 pounds. Her follow-up is going to be in 10 weeks. Hopefully she will be at her 160 pounds, or maybe even a little bit less at that time. She has been counseled to use 160 pounds as a target, but it's not a drop-dead type of goal. She feels much improved now. She's greatly reduced her chances to develop type 2 diabetes, as long as she continues on the normal on the path that she currently is on, I should say. So that basically concludes my oral presentation on Annie Smith, 36-year-old female patient that I encountered. Thank you very much.